Hello, my name's Christopher Button. I'm the lead cancer nurse at Calderdale and Huddersfield NHS Foundation Trust. In this video, I'd like to introduce you to the different types of cancer treatment that are available. Please bear in mind this is only a brief overview and your clinical teams will be able to give you more detailed information about any specific treatments you may be offered. The aim of treatment is to cure the cancer or control it and relieve its symptoms. One of the main forms of treatment is surgery, and this is when the surgeon removes all or part of the cancer, and it can be used to treat many different types of cancers. The impact of surgery will depend on the extent and type of surgery you have. There will always be time needed for recovery post-surgery, but your team will talk to you about any specific operations that you may have and any specific recovery periods and side effects that you may have of that particular surgery. Another form of treatment is chemotherapy, and this uses drugs to treat many different types of cancer. It is commonly given as an injection into a vein, or maybe given as tablets or capsules. It often means regular visits to the hospital chemotherapy unit. Chemotherapy drugs can affect healthy body cells as well as cancer cells, and this can cause side effects. Most side effects will go away after treatment stops, and many of the side effects can actually be treated with other medications. Radiotherapy, this uses high energy X-rays to treat cancer. It destroys cancer cells in the area where it's given, and some normal cells around the area can also be damaged, which can cause side effects. These cells usually repair themselves and the side effects resolve once the treatment is finished. And again, supportive treatments can be given along the way to reduce the burden of those side effects. Hormone therapies work by altering the production or activity of the body's normal hormones. They are commonly used to treat breast and prostate cancer. They are usually given by injection, but can also be given as tablets. And general side effects can include tiredness, headaches, feeling sick, and muscle and joint aches. And again, supportive medications can be given alongside hormone therapy to reduce the burden of some of those side effects. And finally, in this section, just want to mention immunotherapy. And these are treatments that use the immune system to find and attack cancer cells. There are different types of immunotherapy, and each one uses the immune system in a slightly different way. So specific information about the side effects for the type of immunotherapy you are receiving will be available from your clinical teams. As I mentioned earlier, this is a brief overview, and more detailed information about your treatment and any side effects will be available from your clinical team. Many of the other videos available as part of the first steps will help you prepare for and better tolerate any of the treatments I've mentioned today. But I just want to finish with a quote that we often share at our face-to-face first steps sessions. And this is a quote from a patient who had been through some treatment. And this particular patient said, "It is the uncertainty when they tell you what side effects you may get, but many people get very few side effects and some get none at all. Think of this as a short period of treatment to make things better in the long run, although I know it is not easy." Thank you for listening.